welcome, friends, and thank you for tuning in to another episode of the Optimal Health Program. Hope you're all doing very well. A lot of great information to cover today. We'll talk about hypertension, statistics, what to do about it, and arrhythmias, two very serious conditions that people don't realize can rob them of their health and their lives. So many people have hypertension, don't really feel that bad, but they don't really have their blood pressure checked often. So now, as we talk about the importance of testing your pressure, your blood sugar, your oxygen, your pulse, we talk about monitoring patients at home so we can gather a lot of this data and make sure, though, as we track you, your levels are in perfect range. Even RFK Jr. put a big discussion out about remote monitoring at home because it allows you to have a great link or connection to doctors to be able to correct problems immediately rather than to allow these things to go on hidden and, people don't understand what's occurring. With hypertension, statistically, and this was back many years ago, looking at hypertension numbers, 50 to 60 million people have hypertension in this country, and the numbers have just increased dramatically. The numbers are completely out of control. Hypertension can occur from low magnesium, potassium levels, can occur from extra weight in your body. Medications may interfere and create problems or side effects for you. So we have to take a better stance on this. Looking at groups of people in the population and looking at men versus women, for example, with hypertension. From the ages 18 to 24, 2.6% of men, 4.6% of women have hypertension. 25 to 34, 5.4% for men, 8.4% for women. So women have higher levels of high blood pressure throughout their lives compared to men. At 45 to 54, 27% for men, 30% for women. 55 to 64, 43, 42, 65 to 74, it gets close to balancing out almost even. 59% of men and 59% of women, 75 and older, 70% men, 60% women. But that's bizarre. Why should throughout their lives women, comparatively with age adjustment, have higher blood pressure than men? There may be something to do with exercise, maybe something to do with diet, maybe something to do with percentage of body fat. If we're looking at kids today, kids are heavier than they should be. And it's not just a few or small percentage of the population. So young girls and boys, their weight is above where it should be. And that may be contributing to this. So they're talking about hypertension defined as the top blood pressure number, systolic, greater than 140 millimeters of mercury, and diastolic greater than 90, greater or equal to 90. So we've got to be able to make a big difference and change this. Over 86 million adults, hypertension. This is 2017, and the numbers are just skyrocketing. So, as I say, we want to track you at home, and the mechanism that we talk about all the time, remote patient monitoring for our Medicare patients. But this is important too, I think, for the younger population. But for Medicare patients, we could do a telehealth visit, get a lab to come to your home to do blood work, go over the blood work with you, send home a blood pressure cuff, a smartwatch, send home a glucometer if you're diabetic, even an electrifying, like in Greece.
Grease light.
Each of the devices sends us the data, so we can be tracking that data and looking for highs and lows. And there are alarms or warnings that are put on the devices. So if your blood pressure went to, above 140 over 90, it went to 170 over 100, we'd get notified, and then we obviously can take steps to be able to help to correct that. So, and we want to engage family members or aides, people that are with, the patients, so that we've got a great connection, back and forth. So,
got some questions over here, Doc. I've got high blood pressure, and my doctor mentioned arrhythmia too. Are those two separate conditions or connected?
Yeah, they're two separate things. So blood pressure, the top number, systolic, is how much pressure you have to push. Your heart has to contract to push the blood into your blood vessels going out to your body. And if you're fit and healthy and in shape, your blood pressure's at a great range, 120 or so over 60. It's easy to pump the blood out. You're delivering oxygen, vitamins, minerals, and hormones to all your cells. The higher that pressure goes, the more strain on the heart. Back pressure against the heart, like pushing up against an object that's hard to move, will cause hypertrophy or increase in the size of the muscle fibers of the heart. And that's not good because it makes the heart strain a little bit and struggle sometimes. And if the hypertrophy occurs on the inside chamber of the heart, then you're narrowing down that chamber. So that's, your hypertensive issue. And the diastolic number, the bottom number, is what pressure exists on your heart while you're filling it in between contractions. So it's contraction, fill, contraction, fill. You don't want that to be high either. So these are things we want to be able to track and fine-tune and fix. Arrhythmias are irregular rhythm, irregular beat, irregular rate of the heart, and your heart should, bum, 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 bum. It can go faster when you're doing exercise or activity. If you're stressed out, your heart rate might go faster, but the rhythm that comes from the top part of your heart, the sinoatrial node, has its cadence, and that sets the stage for triggering the atrioventricular node between your atrium and your ventricles to contract so that you have the top and a bottom, top, bottom, boom, boom. That's how the contraction occurs. If there are new areas of nerve firing in the top part of your heart, in your atrium, they would call that atrial fibrillation. So the heart may be twitchy on top, which is making some irregular lower heart ventricular contractions, and that can set the stage for anxiety, irritability, shortness of breath, a lot of weird symptoms. But it can also create a clotting effect if the valves are now fluttering or you have fibrillation. So there's a lot of risk to that. We tell people to check your pulse all the time. Go get a pulse ox from the store, from the drugstore. Check to see what your oxygen, what your pulse is like. Get a blood pressure cuff, etc. So start to understand what your body's doing and look at your vitals. Of course, there are far more issues for people that have hypertension and arrhythmias when you're older. So that's why all of the Medicare age patients, 65 and older, we want to track and make sure we can keep them in the perfect range. I've been doing this for a while now, so we have patients where they've had their blood pressure start to spike a little bit. So we've gotten notified, we call them, we tell them, okay, did you skip your blood pressure med today? If they did, we got to take it. If they're taking a low dose of something, we may have them take another dose in the afternoon if we see that their pressure's high. Or we may give them magnesium, potassium if they have a history of deficiency of that to help to improve their blood pressure. Similar circumstance with arrhythmias. Whether it's medication or minerals that we might use, magnesium, potassium, we want to be able to stop the issue from happening now so that it doesn't progress into something more significant or more difficult. So yeah, they're two different things, but they go hand in hand because they're affecting, the same organs.
Got a few here. I sometimes feel like my heart skips a beat or flutters for a second. Is that a sign of arrhythmia?
Well, any irregular, out of the ordinary, direct, normal cadence heartbeat could be a palpitation, could be a skip beat, a drop beat. Sometimes the electronic wiring of your heart could be affected. So an EKG is a very good thing to do for that. So is an echocardiogram. You're looking at the electrical function of your heart. Everyone's seen that EKG rhythm, whether it's on those hospital TV shows or movies. But you want to have a nice, smooth, rate and rhythm. Looking at your valves open and close, your heart contract, how much blood you're pumping out per beat with the echocardiogram is an important test as well. But you want to be able to see, what's causing that, because you don't want that to progress to become more significant skip beats or drop beats, that it becomes risky. No. Again, sometimes that's corrected with vitamins.
Someone's asking, my dad had a stroke and my mom has AFib. What can I do now to avoid going down the same road?
Well, get some good testing done looking at your circulation. EKG gives us an idea as to what your heart's doing. I would test your vitamins, minerals, hormones, look at heavy metals because heavy metals are linked with arrhythmias and hypertension. Learn about your body as much as you can. And this is, of course, what we do for everybody. And then fine-tune things so you're maximizing your body's health and stability. People that have strokes almost always have hypertension before the stroke, and that's what contributes to it. There are strokes caused by a clot. There are strokes caused by a bleed. But hypertension is an extremely common, if not the most common cause of stroke. And for those people who had a stroke, we do stem cell therapy to get new cells into your brain to help to maximize your healing potential. And you can look at the videos on the website for some of these things. A lot of great videos on the website, drcalapai.com. Calapai, there we go, .com.
I'm quick. I'm quick, Doc.
You are. You're the fastest in town, Frankie.
So someone's saying that they've been staying away from caffeine because they were told that it triggers arrhythmias and blood pressure. But is that only for sensitive people?
Not everybody will have arrhythmia from caffeine. Not everybody will have high blood pressure from caffeine. But if you are sensitive and you have those issues, then I would stay away from all things that have caffeine in it. Of course, the blood test that I do, as I mentioned, it's a 25-page blood test. For those individuals that have arrhythmia or hypertensive issues, we always look at red blood cell magnesium and potassium. It's a more accurate test than just looking at the serum magnesium and potassium. So we would try to correct nutrients. We talk a lot about, putting the vitamin packs together specific to your condition and your blood test results, so your vitamins become perfect over a very short period of time, within a few weeks. So we'd have to learn about your body and figure out what may be occurring that can allow those things to happen.
Someone wants to know, true or false? How does salt really affect blood pressure?
For some people, it does. There are some doctors who say, using more of the natural salts or the Himalayan salts, you have less of an issue, but it's a person-to-person thing. So is a person overweight? If a person's overweight and their pressure is kind of coming up because of that, and you add a little sodium on, too much, table salt, yeah, you're going to hold on to water, and you may see your pressure rise. In people that are lean or healthy or fit and they have a little bit of salt, it's not going to really affect them. So it's not a light switch on and off. It's looking at a variety of different variables. And in some people, you've got 10 or so different things occurring at the same time that contribute to the symptom.
Got it. Another caller asking that they were prescribed beta blockers and felt super sluggish last year. Are there alternatives that don't slow me down as much?
Yeah, there are lots of meds that will not make you feel tired or sluggish. Sometimes when doctors give you a beta blocker, because it's relaxing a beta receptor, on one hand, it can keep your pressure down. It may decrease irregular heartbeat, but it can make you tired and a little bit out of it if your blood pressure goes too low. And that should be tracked. In other words, if we had a Medicare patient that we wanted to put on a beta blocker on board and it was beneficial for them, wanted to try it, we'd have them set up with their blood pressure cuff at home, and every day they're reading their pressure. If after a week I saw their pressure was too low, then we'd switch it. So this is another great discussion of how quickly we can fine-tune the patient, by having the vitals done at home. There are calcium channel blockers. There are all sorts of different meds that would not make you tired. Some of the beta blockers also affect sexual drive and function in men, so that may be a reason to use something else. For those people using diuretics, one of the problems with diuretics is that you may be pushing out magnesium and potassium with that diuretic, and that could be the cause of your high blood pressure, so then the cause is made worse and you need more meds. So you have to be very careful when you're using meds and diuretics in such a fashion.
Got a comment here, just someone saying that I've noticed more kids at my kids' school seem overweight now than when I was going up. It's unbelievable.
Absolutely. So we can comment on poor diet choices. We can comment on inactivity. I mean, when I was a kid and we had 30 or 40 kids around my block, in the immediate block, one corner to the next, etc. And then a few blocks over, another 30 kids, a few blocks, in each direction. There were kids all over the place. Nobody was overweight. And then when you get into, pre-high school, you get into high school, there weren't that many kids overweight because you did a lot of stuff. You played a lot of sports. I mean, my friends and I, whether it was crazy or not, but I look back and we didn't have any spectacular upbringing. We didn't have tons of money. We didn't belong to all the clubs that kids are in today and these organized, expensive sports and traveling team stuff. We just played in the neighborhood. We played stickball, kickball, street hockey, which was one of my favorite, was so much fun. My friend's dad was a fisherman in Sicily, and he had all these nets that he brought over with him. He probably never used them again. We made our own goal nets, and goals with 2x4s, frames. We built it all. And, we bought gloves and sticks, and the pads we used for our goalie, Alex, were like foam rubber and cardboard, and we wrapped it with duct tape. It worked. I mean, who cared? We didn't think anything of it. We didn't need all the expensive equipment, but we had the best time. We played football, baseball, kill the guy with the ball. Every sport you could play, we played. So, we were super, super active back then, which kids are not active at all today. There are some who join a hockey league and they're playing hockey at night in a rink, and yeah, they're active and they're healthy, and there are some playing soccer, but comparatively, there are more kids overweight now than ever before in this country. Other countries, not really. So it's just a whole different world. And look, there's a lot of junk food that's been consumed in the past 40, 50 years.
Hopefully getting better.
If you choose to do that and you're not active, yeah, you're going to have problems as a young person. Those the people that in their 20s are going to have hypertension or other issues. It just didn't exist back then. There was no chance to, get fat or eat junk food. We just never did it. We had to be home at a certain time, and when Dad came home from work, we'd sit down, have dinner. Everybody was at the table. There were no phones. It was a wonderful upbringing. Wouldn't trade that for the world.
And I'll just say, as someone who was, born in the video game sphere, when I was a kid, video games were played when it was raining out or it was too late to go out. Yeah. Now, things have changed.
Well, the companies that make these games and, the cell phone companies and all of this and the people making these apps know how well people get addicted to these things, and just like gambling addiction, and there's gambling on cell phones and computer. I mean, there's just so much addiction to these devices in every way, shape, and form that unless you really, really are firm and, can control yourself or your kids' desire to do this stuff, it's going to be a problem.
Got someone just asking. My 11-year-old is gaining weight and becoming more self-conscious. How do I help without making it worse emotionally?
Typically, and we see, young kids at that age all the time, parents come in, and sometimes the parent comes in to get their blood done. They bring the child in. And then we're talking to the parent about all this cool stuff and eating right and vitamins, and the kid just goes along with it, and they like the idea. And they may, at that time, and the parent may want to do this, we may talk about it in advance, then if you want, we could set a chart up for you, and, we'll do the same thing for you. So it becomes easy to do with the parent and the child, because you don't want the child to feel, uncomfortable or out of place. And the same thing that the parent does, now the child does. And now they're both doing a low-carb diet, and they're exercising, they're walking around the block together. It's just a smart way to do it.
Right. That's very smart. And someone else in the chat just saying that they had their whole family change the eating habits so that their one child would not even think about it. And
Perfect.
Not even think the pressure was on
Perfect.
Them. Love the back
That's
and
great
forth.
Support system for sure.
Yeah. What else we got? Hold on.
Talking about food and stuff, and I told you this before we started today. Funny things happen to me randomly. So, and sometimes I burst out laughing because I can't help it. I went to Whole Foods today to buy some stuff. I went to buy these Cool Go macro bars, which I think are delicious, organic and vegan and gluten-free bars. Go macro. Go macro. So I get a bunch of things. I'm online. And a woman in front of me's got probably a 3-year-old kid in the basket. And the kid's a little fidgety and stuff, but a cute kid. And the mom's doing her best to kind of keep the kid engaged. She goes up, puts all her food, and starts to put it up on the conveyor belt to the person. And I'm going to turn to look at something, and all of a sudden here, splat, splat, splat. As the mom is putting stuff on the conveyor belt, the child is just launching stuff out of the cart. So the mom didn't realize it because she was focused on putting the stuff on the conveyor belt, getting the in-store code from her phone, clicked on so she could have some savings. And I just sat there, and the person behind me, we just broke out laughing. So I went down to pick up all the stuff the kid was throwing out. Now she's throwing with me because I'm down near the floor picking the stuff up. So I'm just blocking, getting hit in the head. And the mom, oh my God, what are you doing? Blah, 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 blah. I said, don't worry about it. It's funny. But it's a funny story to tell. But the poor mom, she has her hands full.
What was he throwing? Was it just
bags of like frozen vegetables and stuff like that, from what I can remember. There weren't cans, thank God. I wouldn't want to get hit in a can of something. But yeah, bags of things. Some cheese, some they have a whole section of Whole Foods that has like tofu and different things, seitan and other foods where, people that want to be more vegetarian can get. But she was launching the stuff out of the cart, and she was laughing like crazy. And we all started to laugh.
Love it.
But yeah, you never know when something funny is going to happen.
Someone said, when I was a kid, we had no video games. We had arcade games in the mall, and the only video game for home use was the Pong.
Yeah, pretty much. There was Tetris, a handheld Tetris thing that was around. But yeah, you might go now and then to an arcade and play some games, but you had to either come with quarters or money or something. You ran out of money, And if your parents gave you a couple bucks, and it was limited,
Yeah. And someone else just saying, look at the comparison between 90s school lunches to today's school lunches, and I think we could find the culprit. Okay.
Absolutely.
Yeah, you see that one.
I remember even being in elementary school, and the lunches were pretty good. But then all of a sudden, some people who think they know better start to change school lunch and then make it a disaster. It's got too much sodium and fat and everything else in it. So, it's a shame. It's a shame as to what's happening to the children of our country over a bunch of years in just about every way.
100%.
You could extrapolate that thought. Health-wise, what's been going on. It's bad.
I mean, I could remember being in elementary school and sitting down for the health teacher to come inside and put up this big pyramid and talk to us about our diets. And wow, did that age well.
Yeah, you're impressed by it because it's a cool thing. Oh, food pyramid, eat tons and tons and tons of grains and sugar and carbs, and that's created more problem. I mean, no country in the world has had that huge influx of grains, and now GMO grains. That's what's made everybody fat. That's what's made obesity and hypertension, diabetes. A lot of things occur in this country because people just go way overboard, with carbs. And I can tell you in 39 years of doing this and talking to people about what they eat, cutting the carbs down, having good proteins, vegetables, vitamins and minerals and all that. Now, people that are following the low carb, because it's the biggest diet in the world and has been for years, every diet book now is on low carb. And some people are even going to the intermittent fasting, which research has talked about longevity with fasting for years. And people losing weight, they're eating smaller amounts of food. They're doing really well. So finally, the tide has turned.
Oh, yeah. Someone's saying we had unhealthy school lunches back in the 70s, too. Hamburgers and Elio's pizza. Hey, I'll take a burger. Better than my pizza sticks I had and mozzarella sticks. That's all they gave me.
Better than what they're having now,
Yeah.
And better than kids going out to a million fast food places and just getting all this bad stuff. So, there was something that said that French fries at these fast food places now has a chemical in it that is used for something, for roofing on homes or something like that. It was pretty bizarre.
That's great.
Yeah. Chemicals. I mean, go out, get some organic potatoes, cut them up into French fries, and make them for your kids. It's not hard. I mean,
fry them twice if you want them extra crispy.
Yeah, I mean, it's not difficult. If they want to have that sort of flavor or thing, you could take potatoes, cut them longwise, thin, put them on a plate, a little bit of salt, olive oil, put them under the oven, and make your own chips. At least you know what you're using and you're controlling the the food as opposed to getting all sorts of other garbage in it.
And someone's also saying, who also has a kid in school, saying that physical education in schools is basically an afterthought now. Kids are able to skip it all the time. It's unbelievable.
So even one class a day with phys ed is a good thing. You may not be running a marathon in a class or doing a lot of activity, but it's something. But it also goes to the psyche of having the kid want to do activity and exercise. So when I was in school, we did it. It was great. Kickball, dodgeball, whatever we did, baseball, etc. And sports was an integral part of a kid's life. And when you got home from school, you'd play other sports, and you'd do different sports every day. And, you did it because it was fun. And I remember knowing just about every player on every team that I liked in the Mets and such. I was a Met fan as a kid and Jet fan as a kid. We used to go watch them play, etc. At Hofstra, or Shea Stadium back in the day. But all your friends knew the players. We'd play with baseball cards and flip to see who got what. I mean, it was part of everything. Now, kids are watching TV. They'll watch a game at night, but there's just no connection, to that sport.
So true. So true. We had unbelievable. Someone said, is it true that some experts believe this generation of kids might live shorter lives than their parents?
I imagine so, because when you look at statistically how many of them are overweight, how many of those overweight kids become diabetic because they haven't changed the bad habits? Absolutely. How many of them will have issues with high blood pressure, with plaque in their blood vessels, with heart disease? Absolutely.
It's so crazy to think. I remember a moment, I believe it was my biology teacher talking to us and saying, you guys are lucky. By the time you guys are adults, the average living age is going to be over 100, this and that. And it's wild.
Yeah, so some things with predictions are just sort of vague and generalized. If you want to be healthy your whole life, you have to work for it. And I tell patients that every day. If you want to be healthy, you've got to exercise every day. Go for a walk around your block. If you don't want to go all around the block, go for a walk around the perimeter of your house, your property. Drive yourself to the beach, go to the boardwalk. I have a lot of patients do that. Drive to a park or a school, do laps around a track, something. Just get outside and do something. If it's too cold outside, then have something you can do in the house, an exercise bike. But you really should be doing a half hour of activity every single day, nonstop. People say, well, I walk a lot at work. I say, but you walk and you stop. So that momentum that's created for a 2-minute walk stops, and you're not getting that ultimate benefit. So at least 30 minutes a day. I tell people 45. If you tell them 45, they do 30. You tell them 30, they do 15. So I got to shoot more of the 45, range so people will do it. And, it could be any activity. Some people like yoga, Pilates. I think that's great. Some people like the gym. Some like elliptical, treadmill, whatever. Recumbent bike. Just do a half hour to 45 minutes of something every day. You have to.
Someone's asking, do you still do chelation therapy, and does that remove mercury from the bloodstream?
Yeah, so chelation's been around forever, probably close to 100 years now. Initially, it was used to help detoxify people getting poisoned, during wartime and such. But chelation's an important technique because it can bind to heavy metals and pull them out of the body. We could see what metals are in your body. Blood tests, initially, we would look at metals, and the blood labs do 5 metals. It's not a lot, but at least it's something. It's a screening. If we see them there, then we do the urine test. And a random urine test looks at 21 metals to see what's leaking out of storage. And from that, we'll do an IV chelation with calcium EDTA. After that first chelation, you collect urine for 12 to 24 hours so we can see what we're pulling out. So that's the most accurate way to look at what's in your body. And then if you do 10 of those treatments, at the 11th treatment, you repeat the urine after it. And now you have the first urine and the second urine, which is after 10 treatments. And you can see how much depletion of those things you have, which is ideal. It's the proof that you're getting rid of those things. So that's how it's done. Yes. And metals are linked with organ failure, cancer, neurologic disorders, Alzheimer's, Parkinson's, MS, all sorts of bad things. There's no benefit to the accumulation of metals in your body. And we could talk about that with kids too. Kids are being exposed to levels of aluminum and mercury that are through the roof, that are way beyond every other, normal limit of something. And when women are pregnant, they tell them, don't eat the fish because there's aluminum and mercury in it, but they're recommending injections for pregnant women, which makes no sense. And the schedule of injections for children is way beyond appropriate. I guess I could comment on the CDC in their discussion of 1,152% increased risk with the hepatitis shot for the newborns. 1,153%. It's in all the commentary.
Crazy.
So people have to really evaluate and reevaluate and read and learn and listen. Make up your mind. On the good side.
Someone's just asking, I had a bunch of old silver fillings removed. Is this something I should be interested in, the chelation?
So, yeah, what we tell people is that the silver fillings are half mercury, which they are, and that's been there forever, which is a horrible thing to have sit in your mouth. And as those things get into your bloodstream and your teeth, they can affect your body anywhere. I've had patients that have fillings removed, but they did too many of it at once. The patient developed a tremor because the removal process allowed the liberation of those metals, and the person had issues with that. Of course, we chelated them and we pulled that out, but typically when people have fillings removed, if you have 2 or 3 on each side, whatever it is, do one at a time, but then make sure you do chelation right after that, the day later, that removal, so you're grabbing it to pull it out. And maybe do that once a week, and over the course of a few weeks, you can have the fillings removed, but you want to be able to deplete that rather than allow it to increase in exposure. If you did it a while ago, you still want to do the chelation because you want to see what you're up against.
So someone's just asking that they've been exposed to mold. Is chelation ever used in cases like that or just for metals?
Not for mold. Chelation is primarily used for metal detoxification, remove those things from your body. Mold, you'd have to really clean and remediate the home. We have a lot of people that do that. Mold issues are pretty significant. We've had people that have allergies to mold, and we do allergy testing and treatment for that, so we know how well that can work.
I'd imagine this is a troll, but someone asked, what about AIDS? I'd imagine that doesn't make sense.
What about AIDS?
What about AIDS? Is this chelation related or just that's
AIDS?
AIDS.
Typically, people do well with intravenous vitamin therapy because the vitamin IVs can help to quadruple killer cells. In a similar fashion, you look at all their vitamins, minerals, hormones, maximize their body's ability to fight things. And yeah, there are medications that are used that are successful. But you want to make that person's diet as strong as you can, nutrient levels as strong as you can.
Got it. Any concerns, ethical concerns with chelation, like using it on vulnerable patients without? I think there's a typo there, but if you could give me that.
What was the question?
Are there any ethical concerns with chelation, like using it on vulnerable? I think they tried to say patients. I don't know.
Using it on vulnerable patients?
I don't know.
Not sure what that means.
The trolls are in the chat. Nothing makes sense right
The discussion we have for all sorts of different things that we do are full and complete and are recorded on my electronic medical record. I'm not sure what they mean by a vulnerable patient because all of our patients, give consent after a lengthy discussion about all these things. So patients choose to do what they do. We're not forcing people to do anything. We're just explaining things and people choose their options. And that's what consent forms are all about. So, yeah, no such thing as, vulnerable people and making someone do something they wouldn't want to do.
Something's in the air today, Doc. But someone's just saying that they had noticed, they've looked into, there's oral chelation and IV. Which one actually works?
The oral chelations don't work, and I can tell you from a whole lifetime of practice that we've seen people try chlorella, spirulina, saunas, all sorts of things, you name it. Zeolite is something that people have tried. But of those individuals that I've seen, and it's many that have tried those things, if they've gotten a result from that, then you shouldn't see the metals show up in the urine test. So when we come in for a consult, they say, I've done this for so many years. Okay. We'll look at the blood to see in a screening fashion if the metals are there. If they are, that means they've come in recently from diet or food or antiperspirant or whatever, or maybe water in the home. Then if that technique has worked so well, when we do the IV and the urine afterwards, nothing should come out. But overwhelmingly, we always see metals come out. So I have yet to see where people have had any significant benefit or result scientifically by doing that urine test after the IV to prove that the metals were removed or depleted. I see that all day long. Every day when you do the IV and you do the urine, you do more of the IVs, and you do a secondary urine, you can see how much has been pulled out. You can watch it become depleted. So that's the science of that. You don't have that with these other techniques. A foot bath or a foot pad, yeah, the pad may turn dark and the water in the bath may look gnarly and dark and bubbly or something, but there's nothing that says that there's something in that pad or that bath that's going to get into the body. There's no description of how something goes to do what it's doing and pulls things out. And there's no testing of the pad or the bath to see what came out. So it's nonsense. Non-science and nonsense are words that are kind of like close together. But we need science to tell us what's happening. That's why we do it the way that we do.
Someone's just asking about, what about things like zeolite or cilantro supplements? Are those considered?
I've never seen any of those things improve or remove metals at all. And if people are telling you to try those, we'll say, what's your parameter? What's your barometer? What's your mechanism of testing what you have beforehand, using a protocol, and testing afterwards to prove benefit? There's none. There's no study that says we use chlorella and spirulina and the person had this much and this is how it bound and this is how it came out. And now we see that, there's less or there's, nothing there. There's no study. There's no testing for that.
Well, they responded, I knew it was BS. Good on you. Good on you.
Let the buyer beware. An educated consumer.
Exactly. Someone noticed that some parents are using chelation for kids on the autism spectrum. They're just asking, is that safe or?
So that's been done, and there are doctors that specialize in that. There was a big organization, I forget the name of it. I think Defeat Autism Now was created many years ago by a bunch of doctors, and I'm sure they still have conferences and lectures. And they were trying to use creams and gels and different types of chelating agents to bind to some of the metals. So I think that has been done. I'm not a pediatrician, so I've never treated kids that young. But, the science makes sense because, exposure to aluminum and mercury in significant repeated doses is a bad thing. You can kind of look that up.
Wow. Crazy. All right. We're up to speed there.
So yeah, bottom line is you want to learn as much as you could possibly learn about your body. Figure out what to do to get yourself healthy. Eat right, exercise, correct your vitamins, minerals, hormones, and make your body stronger today and tomorrow than it was yesterday. If you're not doing any of these things, you can see some pretty dramatic benefits. We see this all day long. You get your body into that zone of exercise, and then people are doing more and more activity, which is great. We're tweaking their vitamins and minerals. We're using the custom vitamin packs for patients, perfect vitamin levels. We do hormone correction, perfect to your body's requirements or needs. So you can start to see some pretty dramatic benefit when you get your body to where it needs to be. Some people it takes a little more work than others, but either way, it's the most important thing you could do for your health and certainly for your family's health too.
I read a study saying chelation might help people with heart disease as well. Is that removing metals? Is that
Correct, because heavy metals bind to the bad LDL cholesterol to become a foam cell, and that foam cell very easily attaches to the blood vessel wall and becomes part of plaque. If the blood vessel lining is already inflamed, sometimes by virus, and studies go back many years talking about how viruses can get in and inflame the blood vessel wall, the more that these things add up, the bigger the problem. So although the powers that be and the cardiology groups don't like the idea of using chelation to try to improve, the vascular mechanism, there was a big study called the Trial to Assess Chelation Therapy. Interesting, when they did that trial, you would expect the inclusion patients into that trial were anybody that had plaque. But for some reason, because I reviewed this and I wanted to enter it until I figured out that it almost seemed like it was a trial that was intended not to show result or intended to fail. And what I'm saying is you had to have such strict criteria of really severe heart disease, severe plaque, severe, that even if chelation helped a little bit, you may not see a terrific outcome. People in the study were able to walk better, their legs felt better, their cramping went away, so there was certainly a vascular benefit to it. But if you were to take someone that has plaque that doesn't have all these other medical problems, and you're looking to see if there's a plaque benefit to it, yeah, you might see that more easily in a person who doesn't have all these other problems. Also, they wanted people to have had every heart scan you could imagine. A lot of people don't do that. They wanted people to have an angiogram. Some people haven't, or couldn't get it done. Mugga scan, all these scans, injectable dyes and all these other things. And not everybody had every test known to man for cardiac evaluation. So unless you had all of those tests and you had all the most severe forms, you weren't able to get into the program. So that's why I like the idea that we're trying to see if it was going to help, but they made it so strict that people that had the worst disease and people that had all of those tests done were the only people allowed into that program.
Wow.
Odd, to say the least.
Someone said it's like throwing a deck chair off the Titanic.
Yeah. Oh. Yeah. You're not going to be able to float on that. I love all these funny comments, I guess on Instagram and some of these places. And people are serious. What if Jack were able to get on that piece of wood that Rose was on? They both would have lived. And I say, it's just a story. Jack Dawson never lived, never existed. It's just a
figment,
a Hollywood thing, Well, what if Jack, she could have helped him. She could have. Another one that just came up where the older woman is standing on the back of the Titanic with a massive diamond. And, Bill Paxton, who's a wonderful actor, rest his soul, amazing actor, is trying to talk her out of dropping it in the ocean, but she wants to give it back to where it should be with the boat. And then someone said, yeah, she was with this guy for 5 minutes in the back of a Model T Ford on the Titanic, et cetera, and she had this massive, super gazillion-dollar diamond with her whole life, and never helped her husband and kids and her family that she was with for the rest of her life since she got off the Titanic to help them live an easier life. What kind of woman is she? Wow. So I was like, wow, that's pretty intense. What a perspective. I never thought about that.
And as far as the door is concerned, blame the props department because they could have just made it a little smaller for the seat.
Yes. But very funny. So there's a lot of funny things out there. I try to laugh every day about something.
With inflation.
I tease my mom every day about something, so I make her laugh all the time. And she's listening now.
Oh, my face hurts. We have a question on, does CAT scan and MRI contrast contain toxic metals?
So, yes, gadolinium
That's what they actually ask. Gadolinium ?
is a dye frequently used in these tests. Cesium is another one. There are a few different things that are used, and I usually tell the story about Chuck Norris and his wife. Everybody knows who Chuck Norris is. The famous Chuck Norris. His wife was having all sorts of tests done, and she repeatedly had gadolinium done, and then she was getting sicker and sicker. They couldn't figure it out until one doctor who was astute and smart said, "Hey, I've had a lot of tests done. Let's check your gadolinium levels." She had gadolinium levels through the roof. And I'm certain they chelated her to remove that from her body, and she's done well ever since.
Wow.
So gadolinium-induced toxicity is a term that was created as a result of figuring out what happened to Chuck Norris's wife.
No way.
Yep.
Wild.
True story. So yeah, those dyes, they just don't leave your body. And I know that because I see gadolinium on, the urine tests that we do for people. You see barium, and barium usually for barium enemas or some of the barium swallow tests. But a lot of these things just don't leave your body.
That's good to know, Doc. Counting my...
That's why you got to check for these things in your blood and your urine and get rid of them.
I'll be at your office tomorrow. Okay. That's crazy.
It's amazing what we're exposed to. And I've said this every week and every time we talk about, thank God RFK is, doing something to try to get the junk out of the food. I think they're getting the mercury out of the vaccines.
That's what I heard.
I just read that. Thank God.
I did see something about child. We'll ignore that. We're on YouTube today. Caught myself.
We are. We love YouTube.
We love YouTube. We like to stay on YouTube.
Yeah,
so I'll
we love
skip
YouTube.
That
We
question.
like Rumble. We like Instagram, Facebook, Spotify, all of our platforms.
All right, what else we got?
So here's a little, we were talking about arrhythmias before. I forgot to pop up the article. 1 in 3 people are at risk of a serious arrhythmia. And the numbers of people with arrhythmia, where is that crazy number?
Just real quick, while we're still
Yeah.
on that, they're asking, is gadolinium radioactive?
Most of the dyes that are used or are injected are meant to show up when you do an X-ray or CAT scan or MRI to show the uptake of that substance. So it does have that property to be able to show where your blood flow in your coronaries or your vessels are, or to distinguish a tumor versus normal tissue in your brain. So, it's not radioactive like...
Thermite.
Something that, could really kill and destroy populations.
All right.
Where is the number? So they're talking about 1 in 3 people in the population having arrhythmias, and I think the number was in the billions. This is worldwide. And they've created Pulse Day for people to look at and keep checking their pulses. March 1st is Pulse Day all over Europe, so people are supposed to check their pulse.
That's like
March
a holiday
1st.
for them?
I guess.
What a system, huh? Do you get it off for work? I'll take that in America.
I will stay home and check my pulse every 15 minutes. You want to keep checking your body. You want to learn as much as you can about your body.
Is MRI contrast safe for kids? My daughter had one for headaches, and now I'm wondering if it was necessary.
The doctors and radiologists say that it's important so they can get a better look at tissue. I don't read x-rays and MRIs and things all day long like the radiologists do. I'm sure it gives them a better picture. But, there very well may be some side effect to it, like we were mentioning before.
Do people with metal implants or dental work need to be careful about contrast exposure?
Everybody needs to be careful about contrast exposure. Because if you're putting something into your body with some repetition, it's going to create a problem sooner or later. And some people, the problem comes earlier. Some people, the problem comes later. There's no gauge as to how many tests can be done. And think of it, if you're young and you're healthy in your 20s or 30s and you do some of the tests, you may not feel it or know it. But then as you get older, with those still being there, they may be causing a problem that you didn't realize or know about. There are studies on mercury accumulation affecting heart contraction, damaging heart contraction. And the list go on and on. I tell people to go to Google Scholar, look up all the different heavy metals, the individual ones, or look up heavy metals and heart failure. Look up heavy metals and liver or kidney failure. Look up heavy metals in Parkinson's or Alzheimer's. I mean, aluminum is directly linked with Alzheimer's. We've known that for a very long time. So you have to understand what's going on in your body. It's one of the most important things I could tell you.
Good there.
So the Garden City office is 516-794-0404. 516-794-0404. Website, drcalapai.com, drcalapai.com. Find out about our custom and vitamin pack recommendations for you. Even for people that can't get to the office, our wonderful mechanism of telehealth allows us to chat with you, potentially send a lab to your home to get your blood done, review the blood test a week later when it comes back, and from that, make up a perfect vitamin recommendation for you. And that holds true for all people. So everyone should have perfect vitamin levels. And for those who have issues with chronic illness, blood pressure, diabetes, heart disease, COPD, a variety of things, we want to introduce you to the understanding and the mechanism of remote patient monitoring. Understand what your body's doing. Check your vitals at home. We get the recordings of that and keep you in a great state. So many people are having problems getting to their doctor within the course of 3 or 4 months. Here, because we're watching and looking at these things, you could have telehealth visits once a week if you need, or even more often because we are setting that up. So hiring PAs, nurse pracs, etc., to be able to handle, the volume of calls. But that's the way medicine should be. You should be able to have a nice, close relationship with your doctor.
One question from previous discussion. Not a question, just a comment. I think Contrast was responsible for my kidney failure. They gave me at least 6 CAT scans within a year.
Yeah, it's entirely possible. Remember, for liver, kidney, heart failure, a variety of all the degenerative disorders, we do stem cell therapy. So you're taking cells from your body, putting them into the intravenous so they can go where you have damage and degeneration and make brand new cells. So for diabetics, we've seen them become non-diabetic in 2 to 4 or 5 months. We've seen improvement in ejection fraction for heart failure patients, kidney markers for kidney failure patients, liver, etc. as well. So take a look at the videos on the website for that.
Just lost my lot. I just had one. Back to you. Hold on.
Okay.
It's got my Chrome crashed. Come on now.
We'll give them a moment to see if we can get them back on.
I sleep 8 hours a night, but still feel exhausted by noon. Could this be something like mitochondrial dysfunction?
Could be a variety of things. Even sleeping 8 hours a night, which is meant to repair your body while you sleep. If your hormone levels are off, you still might be tired and not getting the good deep REM sleep. If you snore, even though you believe that you're sleeping, you may not be getting good deep REM sleep because you may have apnea. You're going in and out of deep sleep. And most people who have apnea don't realize that they're snoring. Your vitamin levels could be low. Your thyroid could be low. Testosterone for men and women certainly can drop depending upon age. Heavy metal exposure can do that. Viruses can make you feel tired. So there are a lot of things that can cause that fatigue. Some people that have too much carb in their diet, when they have carb for breakfast and their blood sugar goes up, you're training your body, sometimes over many years, to make more insulin because of repeated sugar exposure. And then that carb intake makes your sugar go up. You dump insulin, knocks your sugar down, and you can become hypoglycemic no matter how much you sleep. So there are a lot of different things that correlate with that, which, of course, we test for within our big blood test. So there are a variety of things that can make you feel tired.
Just got a comment here. I would love to come for stem cell treatment, but I need better insurance first.
Gotcha. Well, we'd love to see you anytime you'd like. And for a lot of people that, they come in, they're working their way towards doing the stem. So they may do a telehealth visit over the phone. They may come in, etc. With Medicare, the red, white, and blue Medicare, we participate with that. So the visits, we bill Medicare for those visits. So even the beginning of the workup with the blood test is probably the first best step. And whenever people can do stem, they can do the stem. We're going to be talking about a few other things too. Exosomes, I'm doing a lot of research on because they seem to be creating some great results. But, week to week, we'll give you updates on that.
So looking forward to it.
Excellent. Awesomeness once again. Thank you, friends, for calling in and asking your questions or contacting us, emailing us. Thank you for all the emails we get to the website, drcalapai.com. Love to chat with you. Love to help you out. Certainly give us a call at the Garden City office, 516-794-0404. Email us at the website, drcalapai.com. We'll be back here again on Friday. And then again, big show, really big show on Saturday. Look forward to talking with you. Bye-bye now. Have a wonderful day.